Good afternoon, everyone. Thank you for joining us for our weekly COVID-19 community update.
Recording in progress.
Today, I'm joined by Monroe County Public Health Commissioner Dr. Michael Mendoza, Dr. Michael Apostolakos, the Chief Medical Officer at URMC Straw Memorial and Highland Hospitals, and Dr. Robert Mayo, Chief Medical Officer for Rochester Regional Health. We're going to start today by checking in on our numbers. We're reporting 230 new COVID cases today, which brings our 7-day average of new cases to 216. Last week, we reported 183 new cases and a 7-day average of 164. We're still seeing fluctuation in our numbers, but there's no doubt there's an increase week over week from last week. We continue to be classified as an area of high COVID transmission, according to the CDC. As for vaccinations, we continue to make good progress. More than 464,000 Monroe County residents have completed their vaccine series, and we're just shy of 500,000 who have had at least one dose. That means roughly 3,500 more residents received their first dose over this past week. Almost 78% of our eligible residents have received their first vaccine dose. Again, this week, we have a number of vaccine clinics scheduled throughout neighborhoods in the city of Rochester and throughout Monroe County. Information on times and appointments can be found by visiting www.monroecounty.gov or by calling the COVID hotline at 753-5555. Since the beginning of this pandemic, tens of thousands of Monroe County residents have fallen ill. We've lost more than 1,400 moms and dads, sisters and brothers to this terrible virus. The disruption, sorrow, and grief COVID-19 has caused in our community continues to be incalculable. But we have the power to end it. Getting vaccinated is the best and most effective tool our community has to combat COVID-19. It's safe, it's free, and it works. If you're eligible and haven't had your shot yet, please consider doing so today. Providing new vaccinations to those who have not yet received their first dose is the primary focus of Monroe County's vaccination efforts. However, we're also working on providing booster shots to those newly eligible residents. According to the CDC, boosters have been shown to increase protection against COVID-19, including against the Delta variant. And over the past week, the United States Food and Drug Administration approved single booster doses of the Pfizer COVID-19 vaccine for people who completed their initial vaccine at least 6 months ago and are age 65 or older, or those age 18 and older who have an underlying medical condition or live or work in high-risk settings. Again, that's just for Pfizer. Booster shots are available at many pharmacies across our area. And today we're announcing that beginning tomorrow, Monroe County will begin providing booster shots as well. To start, we'll be prioritizing residents who are 65 years or older and giving boosters by appointment at 2 locations, our Fleet Center Clinic and our clinic operating at the MCC downtown campus. Appointments can be made on our website at www.monroecounty.gov or by calling 211. In the coming weeks, we'll be expanding our capacity to give booster shots at additional locations across the community. So in order to accommodate the growing population of eligible residents that we expect to grow over the next several weeks and months. We'll have more information on those sites as they open in the next couple of weeks. This past Monday morning, the state's vaccine mandate for healthcare workers went into effect, and I had the pleasure of greeting our own healthcare workers at Monroe Community Hospital during the morning shift change. I was there to thank them for all for doing the right thing, for getting vaccinated to protect themselves and to protect their patients. These workers put in incredible hours to care for patients and their residents during the most stressful time. We owe them our thanks and our gratitude. But some of those opposed to the vaccine choose to add to their stress. Protests against the vaccine in front of hospitals, as we saw yesterday, are disheartening. The patients inside are sick. They're seeking care. The healthcare providers are working long hours under considerable stress. Neither patients nor healthcare workers deserve the disdain and anger that's being targeted towards them and where they work. We must be better than that. We are better than that. On the topic of the mandate, as reported last week, the mandate did not impact our critical care delivery. Our hospitals are open for business, and they remain so today. Doctors Mayo and Apostolakos will be able to speak to the impact on their systems in just a few minutes. But I want to speak to the impact at ours. At Monroe Community Hospital, as of today, we have 927 of our staff members have been vaccinated, representing 93.8% of our employees. 61 individuals who work for us are not vaccinated, representing 6.2% of the staff. And we've only had one resignation and have provided only 7 religious exemptions. For those who have chosen to remain unvaccinated, they are being offered unpaid administrative leave for 3 months in the event that they choose to be vaccinated. And then we, of course, will welcome them back. One final issue to discuss today is our schools. Over the past several weeks, we have been seeing an increase in children being sent home with symptoms of illness or for exposure to others who are sick and requiring quarantine. Dr. Mendoza can address exactly what we're seeing more specifically, but first let me say this. Our children belong in school. We all know this. In order to keep them in school, though, and to keep them safe and healthy while in there, it's more important now than ever before that we follow the advice that we know works. Kids need to wear their mask when in school. Eligible family members need to be vaccinated, and if your child is not feeling well, please keep them at home. It is the safest way to help prevent the spread of COVID-19 inside the school buildings and to ensure that instruction can continue without disruption. So with that, I'll now turn this over to Dr. Mendoza.
Good afternoon, and thank you, County Executive Bello, and thank you to Dr. Apostolakos and Dr. Mayo for joining us again here today. As the COVID-19 pandemic has unfolded over the past year and a half, we have constantly had to adapt to what has felt like a steady stream of new challenges, even some that sometimes seemed insurmountable. But not one of them has stopped us from moving forward. That is because we have come together as a community in unprecedented ways to hear your feedback, to evaluate options, to find solutions, and to take the actions needed to get us to the finish line, all the while with science and sound policy as our compass. The past week has tested us like few others before, and because of our tremendous collaboration and communication, I believe we are only stronger than we had been in the past with each and every new challenge. So before I touch on a few of the issues that we've been tackling this week, I want to pause and thank the many, many people who are working to protect the health and safety.
Has this thing started yet?
Especially my colleagues in primary care offices, our local hospitals, our specialty clinics, and our nursing homes. Those who have chosen the path of science and evidence this week in remaining committed to serving the health and well-being of our community. We don't always see them or hear them. We may not always recognize their faces or their names, but I assure you, they are working as hard as ever today, and if we should ever need them in the future, they will be there then too, showing up over and over again to do the right thing, and for that, I am exceedingly grateful. So now let's turn to some of the top issues that we are tackling this week. As many families with young children know, Monroe County is experiencing an unseasonal increase in respiratory syncytial virus, or RSV, a common respiratory infection that can cause mild cold symptoms in most school-aged kids, but can be especially serious among infants, toddlers, and older adults. At the same time, we are seeing a growing number of COVID-19 cases among school-aged children. This all means that pediatricians, family medicine doctors, and urgent care centers are seeing an unusually high volume of patients, and they are stretched thin as they work to meet the usual demands for diagnosis and treatment, not to mention the added testing requirements that New York State has imposed for returning students to school. This means kids are not always getting back in class in a timely manner, which is making it tough to keep schools running smoothly and keep students where they belong, which is in the classroom. So with that, we have tweaked our COVID-19 return to school protocol so that not every student needs to see a healthcare provider in order to get back to school. As long as their symptoms are gone and they've tested negative with the right test, they can get right back to school following our return to school algorithms. For now, the only tests that is acceptable are the nucleic acid amplification, or NAT tests, and the PCR tests, and this is per the New York State Department of Health guidelines. Rapid antigen tests are not currently accepted, again, according to the state DOH guidelines. To that end, we are purchasing the appropriate testing equipment and working with our schools, our healthcare professionals, and the hospitals to increase the availability of the PCR or NAT tests in our community. I will have more to update on this next week. So for now, what can our families do? First and foremost, do not send your sick children to school. Make sure your kids are properly masking and following all of the other safety protocols in place, whether on the classroom, on the bus, or during extracurricular activities. And if they are eligible, please get them vaccinated. The bottom line is, if we want to keep all of our classrooms open and keep all of our kids in school, we need to work together, and that is the only way we will do this. As the county executive noted, we are ramping up our vaccination efforts to start offering booster shots to our community. I want to remind you all, though, that everyone in the community is still welcome for their first dose vaccinations if you have not received those yet. If you have not gotten your first shot, we will prioritize you at our clinic sites, and I welcome you to go to any of the other vaccine sites that are available across the community. I want to remind you that this is how we will ultimately end this pandemic. So with that, I want to finally end by reminding you that the Monday deadline came and went for our healthcare workers to get vaccinated. As you heard, all but a very small number of them remain unvaccinated, have gotten their vaccine, and I'll let the chief medical officers fill in the details for you. But again, I want to thank every single healthcare provider who is on the job today, caring for our sick and injured patients and helping to keep our community safe. I'll be happy to answer any questions that you have about any of this, but first I'll hand it over to my colleagues, Dr. Apostolakos and Dr. Mayo.
Thank you, County Executive Bello and Commissioner Mendoza, for the invitation to be here today. To Dr. Mayo, always a pleasure to join you at these events, and to the media for being here today. I want to start with some really good news, and that's that more than 99% of our staff are still with us. They have either gotten vaccinated, over 96% of our staff is vaccinated, or they've received a religious exemption, and with accommodation are able to continue to work with us. Less than 1% of staff elected to resign their positions. On the not so good news side, we continue to see increasing number of COVID admissions. This is stressing our system. We now have more than 69 patients at Strong Memorial Hospital with COVID, 15 of which are on the ventilator. Through our system, we have 153 patients with COVID, and that number continues to increase. The majority of those patients admitted to our hospitals are unvaccinated. I continue to plead with the community. You've done a great job for us in the past. If you haven't gotten vaccinated, please rethink that, and please get vaccinated for yourself, for your family, for your community, and for our healthcare workers who have been under stress and strain for the past 18 months taking care of you. Please get vaccinated. The other stress on our system right now is, in fact, that a number of nursing homes are not accepting patients who are clinically stable and ready to go to the nursing home. That has caused us to have 55 patients, almost 10% of our inpatient capacity, taken up with patients who are ready to go back to the nursing home. This too has caused significant stress on our system. We are working together with the county and with our colleagues at Rochester Regional to try to solve this issue as a community. And hopefully we'll have more to come on this issue in the near future. Thank you, and to you, Dr. Mayo.
Thank you. My pleasure to be with you today. Thank you, County Executive Bello, Dr. Mendoza, and Dr. Apostolakos. As you've come to learn over the past couple of years during these press conferences and discussions, many of the conditions that occur at Rochester Regional Health are mirrored at URMC or vice versa. And so many of the things that Dr. Apostolakos had mentioned are true for Rochester Regional Health. I'd like to share with you confidently that our leadership team is very proud and grateful of our employees, our healthcare workers who have stepped forward to be vaccinated. We know that for some of those individuals, the choice to be vaccinated was quick and easy, and for others, it was a much more difficult deliberation. And we appreciate the seriousness and thoughtfulness that people undertook to make this important decision. Rochester Regional Health has more than 99% of its employees vaccinated as of Monday when this mandate took effect. So we were very grateful to be able to say that a small percentage, less than 1% of our employees were placed on administrative leave because of their unvaccinated status. That number day by day continues to fall. And so we're grateful that those individuals are choosing to be vaccinated and to remain employed with us. As has been explained, there are religious as well as medical exemption request opportunities. And so we've also had a small percentage of our employees request those exemptions, and we have granted them in compliance with the regulations set forth by New York State. Despite the successes with this vaccination mandate and regulation, we do have understaffed areas, and so our team is working hard. Many people are working overtime. We have similarly had patients in our hospitals awaiting discharge, and so we are pleased to participate in the community-wide effort to create solutions for hospitals and for nursing homes and other post-acute care facilities so that we can all move patients into the appropriate environments as quickly as possible. That will relieve stress for everyone, family, patients, and caregivers. We're also pleased to be participating in the county and community-wide efforts at managing some of the strains on our pediatric practices and the schools relative to the COVID impact on students and their educations. We are committed to helping students get back to school as quickly as possible and want to be part of the solution. And so this is a certain priority for us. So all in all, I would say that the adaptations that are necessary on a day by day and week by week time frame are still moving forward. And it's not been easy, but I'm grateful for everyone who is making a positive difference so that we can all stay ahead of this pandemic and we can minimize its impact on all of us. Thank you, and back to you, County Executive.
Great, thank you, Dr. Mayo. And I'll turn it over, I think, to Tanner or Julie to manage questions.
Thank you, County Executive. Our first question is from Jennifer Lukey of WHEC.
Good afternoon, gentlemen. If I could start with Dr. Apostolakos and Dr. Mayo. We've seen your press releases say, and we've heard you say, expect to wait longer for even routine appointments, expect there to be delays in certain areas. What does that translate into for folks? When you talk about delays, before this staffing situation, we had heard reports of 8-10 hours waiting in an emergency room, waiting room. What realistically should people expect, and when should they use those services and when should they not until we get through this?
Great question, Jennifer. The important message to get out is that we at URMC remain open for essential services. So if you need some medical care, we can provide it. Once again, in EDs, though, there is a triage process, and depending on the level of illness, you could wait for hours. And we ask people to be patient, but the life-threatening, critical nature of illness is taken care of as needed. We encourage our patients to call their primary care providers, to seek health care at urgent cares if their illness is less severe. But certainly at our emergency rooms, you may have a longer wait than is necessary, and it could be several hours depending on the level of illness. The other thing that our patients may notice is that we are pausing on some of our elective surgeries. The elective surgeries that require inpatient stays, we are pausing for the next couple of weeks to assure that we have enough space for patients admitted with COVID and other non-COVID illnesses. So we're asking for patience. If the surgery is essential, we will obviously make sure that that occurs. So there's a number of things we're asking our patients to be patient about, but we're here, we're open for business, and we will continue to work to improve staffing ratios and be able to take care of even the quote-unquote non-essential medical needs of our community.
Yes, that's a great practical question that our community needs to understand, Jennifer. So I'm glad to be able to share the Rochester Regional perspective on this. Our emergency rooms are very full, and there are long waits there. The urgent cares as well have been very full over the last couple of weeks especially. And so it is disappointing to acknowledge, because it's not anyone's wish, but it is true that waits in our emergency rooms can be long. They can be several hours. And once a patient has been seen and is being prepared for admission to the hospital, there may be yet further waits before a room in the hospital is available for them to be transferred. And I know this is difficult for patients and their families, and we want to resolve this, and we work daily to do all that we can to minimize this type of an impact. So we do appreciate the patience and forbearance of patients and their families through these circumstances. Many of our outpatient services have been unaffected. There may be some delays in testing, getting your blood drawn in a station or some other site, but mostly that's been operating at a business as usual capacity. Rochester Regional Hospitals have had a small but a deliberate reduction in some of their elective surgeries. This has been primarily at Rochester General Hospital to manage the other needs of inpatients. Those patients' needs are not forgotten, and we will involve them in scheduling as quickly as possible.
I have like 25 follow-up questions, but I know I'm only allowed 2, so I'm going to throw this one to Dr. Mendoza. Talking about schools, I know that you had said that you had hoped to have the testing program up and running in most school districts by this coming week. What is that looking like, and is it going to be realistic, sort of knowing all the variables that are happening now? I think a lot of parents would feel more assured if they could get that weekly testing with their kids. And do you expect that demand to be higher now as we're seeing so much of it in schools already?
Thank you, Jen. So 2 points. First is that the testing program that we've been working on for the last month is to do surveillance testing. So testing individuals more or less at random who have consented, who are eligible, but don't have symptoms, to ascertain the prevalence of the COVID-19 in that particular community. So the schools have picked up their supplies. I believe they're finalizing the process of selecting those students who've consented and who are eligible, and staff to do the testing. And I understand that they're going to be going live with that next week. This past week, as I mentioned earlier, has brought an additional layer of testing challenges. And that has to do with the diagnostic portion of testing, which the schools are not currently involved in. So currently, the students have been asked if they're being sent home from school with symptoms to go see a healthcare provider and to get that PCR test. Today's change represent, hopefully, a way that we can decrease some of the burden for primary care and urgent care offices to try to get the low-risk kids back to school more quickly. So we are not requiring that they see a healthcare provider, and we're working to increase the capacity of the appropriate test, the PCR test, which, given the current prevalence of disease in our community, given that we're still in the high transmission zone according to the CDC, that would be the appropriate test to use to get kids back to school. So we're working with the labs and the schools to increase that capacity, and we should have more to say about that next week.
Those are, just to clarify, that's a separate test, but it's the Bionex test that it's like about a swab. It's like 15 minutes. It's more rapid for PCR.
So there are several types of PCR tests. There are, quote, rapid PCR tests that can be done in 45 minutes, so not as rapidly as the Binax 15-minute tests, but there are very different tests in terms of the types of interpretations that you can draw from those results. So what we're trying to do right now is expand the capacity for both across our community.
Thanks, Jennifer. Erica DeCoste from WROC is up next. You don't sound like Erica DeCoste.
Absolutely. We've been working with long-term care task force that we convened over a year and a half ago. It has been a lot more active recently. I do want to point out that among nursing home staff, not all staff fit into the same categories. When you look at the physicians and nurse practitioners who work in nursing homes, the vaccination rate is, like among other physicians, upwards of 99%. What we're seeing among other staff, particularly the nurse aides and the CNAs and so forth, their vaccination rate more appropriately parallels the demographic from which they are representing. So if many of them, as happens to be the case, live in the city, their vaccination rate as a population is roughly the same as the vaccination rate that we're seeing in the city. So this is an absolute concern for us. It represents a disparity in care and health access that we've been seeing all across this pandemic. It is a very important problem. As you've heard, the nursing homes have limited the number of admissions that they're taking from the hospitals in order to keep the appropriate ratios in place. They're working very hard to educate their staff to try to have them accept the vaccine. But for right now, unfortunately, for the rest of the healthcare system, they've decreased their admissions, which is creating a bottleneck, if you will, across the entire system.
Sure, I could speak first. This is Dr. Rob Mayo from Rochester Regional Health, and there are on any given day in our Monroe County hospitals a combined 60 to 80 patients in this category. So it is a considerable number. What we do is we continue to care for them. We continue to look for options. We work with our partnered home care agencies to see if there are hybrids. But that changes day by day too, as a patient's condition requires attention to new details that may shift the way the discharge plan is created. So there are things that we do, but by and large, it's a challenge to work through this.
Yes, thank you for the question. At Strong Hospital, we have 55 patients who are awaiting, are clinically stable, awaiting placement in a nursing home. And we work closely with our staff to bring them the appropriate level of care. And what that means is a nursing home patient or nursing home level patient doesn't require as much care as someone who's acutely ill in the hospital. And therefore, we can look at different patterns of working with allied health professionals and maybe fewer nurses to care for the clinically stable patients. However, even once we do that, those patients are still taking up acute care beds in our acute care hospital. And therefore, we're working very closely with the county executive and Dr. Mendoza and having discussions with the state and Rochester Regional. Is there other options that we can look at in order to be able to get the patients back to the nursing homes where their care can continue? And but it is causing a significant percentage of our beds to be taken up, and therefore making it more difficult to get patients through the emergency room and into our hospital and to accept transfers into our facility.
Thank you. Raquel Stephen, actually, do we have a reporter on from Spectrum? I see Spectrum's on, but I don't know if you have a reporter. Okay, Raquel Stephen from WXXI.
Yes, good afternoon, gentlemen. How are you?
Well, thank you. Nice
Great.
to see you.
I guess my question is for County Executive Bello. Just for a clarification, you said 6.2% of employees at MCH have not been vaccinated, but are on unpaid administrative leave for 3 months. Is that 3 months the time that they have to get vaccinated before you
Right.
accept them back? Or and for the hospital systems, do you have a time frame as well, or are you welcoming them
So
this year, next year?
Raquel, thank you for the question. Yeah, we as we said, as I've been saying all along too, we want to encourage our employees to come back. These are members of our team to come back to work if they're willing to be vaccinated per the state mandates. So in order to accommodate that, and also so employees can maintain their benefits and years of service, we put them on administrative leave, offered that to them, administrative leave for up to 90 days. So 3 months. So if during that time period they choose to become vaccinated, they can be welcomed right back into the facility and get right back to work.
I guess after that 3 months is up,
Yep.
They're not.
After the 3 months, after the 3 months, then they would no longer be employed at Monroe Community Hospital.
And for Dr. Apostolakos and Mayo, are you doing something similar at your institutions, or are you just welcoming them? Do they have a time frame at all?
No, if they chose not to get vaccinated by the mandate, we accepted that as a voluntary resignation. However, should they choose any time in the future to get vaccinated, we would welcome them back.
And Raquel, for Rochester Regional Health, we set a time frame of 5 days. So they would go on unpaid administrative leave for 5 days, and then their employment would come to a termination if they did not comply with the regulation.
One more question. I believe Dr. Mendoza, I'm not sure if you answered this already, but you did say that the rapid testing will not be accepted for us students. Is this because it's not false positives can occur, if it's not as efficient? Why is that?
The reason that rapid antigen tests are not currently accepted is because the baseline prevalence of disease in our community is currently high. So when you take a test with a lower sensitivity and a higher baseline prevalence, the chances of a false negative are greater. So that's the reason why we're accepting only the PCR test at this time. But if and when Monroe County falls to a low transmission range, the chances of a false negative for the rapid antigen go down, which would make it a more reliable test to accept in this setting.
And Raquel, it's also a state mandate that in a high or moderate transmission level, the PCR test is required for the return to school. Natalie Kuchko from 13 WAM.
Hi, everybody. Good afternoon. My first question is for the doctors, and this is regarding the vaccine mandate. Now, I know that this has come up already in this briefing, but If there is any healthcare worker in either of your facilities who is unvaccinated and now we are past the deadline, if they are still getting paid, is there any penalty for that, or have they already been terminated? I know we mentioned voluntary resignation already, but if this is a circumstance, is there any penalty there?
Well, Natalie, I'll start on this one. There are a small percentage of unvaccinated workers, because those are individuals who applied for and were granted an exemption. So remember that exemptions are still available, both medical and religious exemptions. For unvaccinated people who did not qualify for an exemption are not being paid at this time. Those individuals are on leave, and then their employment will end, in the case of Rochester Regional, on the early morning of October 3rd.
Yeah, at URMC, the staff that were granted exemptions are allowed to work with accommodation, PPE, and weekly testing to assure they don't have COVID. For those who did not get vaccinated and who did not get an exemption, we accepted their voluntary resignation, and they are no longer with us working. But if they reconsider and get vaccinated, we'd be happy to have them in our employment.
Thank you both for that. And then I just have a follow-up for the county executive. So we know several nursing homes in Monroe County had to pause admissions due to this mandate. In the beginning of the month, we know you had said that Monroe County wasn't quite in the same position as other counties. That expands, statewide as well, not seeing the same effects of the mandate. Fast forward to the end of the month, Adam, would you say the same thing now?
What I said earlier was that our nursing homes, whether or not the nursing homes would still be able to care for the residents that they have, and are we in a crisis? Right now, I don't think that's changed. The nursing homes, particularly, I can speak on behalf of Monroe Community Hospital and other nursing homes that we've communicated with, are able to care for the residents that they have. Just as the hospitals are able to care for you if you are sick or in an emergency situation and need health care, you should reach out to your doctor, call 911. And utilize the healthcare system. What we do have, though, is a situation that has been evolving over the last month, where as staff resignations have taken effect, it's limited the ability of nursing homes to take on additional residents. That's where we're seeing the backlog here in Monroe County. So what the effect really in Monroe County. So in our county, what's happening is that as nursing homes are unable to take additional residents, those residents then are not able to be discharged from the hospital. And so when they're not able to be discharged from the hospital, that takes up hospital beds, which then utilizes additional staff and beds in the hospital system that could otherwise be used for other services, acute care and things like that. So the goal right now is to work, in our view, and what we're all working together on, is how to increase staffing in nursing homes as a community, across the community, so that they can turn it back on, so they can again start to accept more residents, move people who are in the hospital but don't really need to be in a hospital, be more appropriate for their care and their family to be living in the nursing home setting, and to be able to move them in. But I am very confident right now that residents who are in nursing homes right now are being well cared for.
Am I able to clarify one point? Sorry.
Go ahead.
Okay, thank you. So I just want to ask,